Hi, my name is Michael Erdek. I'm an associate professor of anesthesiology, critical care medicine, and oncology at the Johns Hopkins Hospital. I'm here to speak to you today about pancreas cancer and the pain that is associated with that disease. Many patients who present with pancreas cancer also present with pain. It's important for you to know that the pain that you may be experiencing is a very important part of your visit with us here today. We prioritize the assessment and treatment of pain, and you should know that that will be a critical part of your visit with us here at Johns Hopkins. Your visit will begin today with people speaking with you about your pain. You will be asked about the nature of your pain, how long you've had it, how long it lasts, its location, what makes it better, what makes it worse, different interventions or medical treatments that have been tried for your pain. Most often patients begin their pain treatment with pharmacologic or medical management of their pain. This can often consist of opioid or narcotic analgesics. Some of these may include medications such as morphine, oxycodone, Dilaudid, or fentanyl. Most often these medications are given initially in short-acting versions that last for 4 to 6 hours. Some patients may then require these being extended to a long-acting 12 or 24 or even 72-hour long-acting medication plus the short-acting medication for breakthrough. One of the important parts about assessing patients' treatment with opioids is assessing not only the effectiveness of these medications, but also their side effects. These medications may cause itching, nausea, sleepiness, or constipation. Therefore, we often have to strike a balance between the effectiveness of the medication and its side effects. For patients whose medication therapy is either ineffective or who have dose-limiting side effects, we may consider procedural management of your pain. One of the procedures that may be discussed with you is called a celiac plexus block. The celiac plexus is a bundle of nerves that sits in front of the abdomen, it sits in the abdomen in front of the spinal column, usually right at about this level. The celiac plexus block is performed under X-ray guidance here in our clinic at Johns Hopkins, or alternatively closer to you at an institution that might be more convenient for you as far as travel is concerned. When we speak, we'll discuss some of the basics of this procedure. Usually this procedure is performed, the patient is lying down, and a needle is passed after numbing the skin and giving the patient comfortable sedation such that the needle is passed into the vicinity of the celiac plexus. Local anesthetic is then given to determine the effectiveness of the block. If the block is successful, then a very strong alcohol can be given in order to give a 3 to 6 month relief of the pain. If this procedure is ineffective, then a more invasive procedure can be considered. An intrathecal analgesic may be considered for administration of you to treat advanced pain. This is the placement of a catheter into the spinal column such that the medication is delivered close to the central nervous system such that the patient achieves maximum benefit from this with minimal side effects. This is a procedure that is done in 2 stages. Initially, a temporary catheter is placed into the back and given over a 3-day period in the hospital to determine the effectiveness and the appropriateness of this treatment. If this all works out for the patient's best interest, then the patient is scheduled for surgery for placement of a pump and catheter system such that medication can be delivered through this pump reservoir into the spine with a minimum of side effects and a maximum of effect. So you can see there are many options available for treatment of your pain, anything from medical treatment through procedural treatment. It's important once again for you to know that as you are seeing surgeons, oncologists, and radiation oncologists, you also have the option of seeing a pain medicine specialist such that your pain is adequately and effectively treated. Thank you.